A fontanelle is a soft membranous gap between the cranial bones. It is often found in an infant's skull. They occur where sutures meet and allow for brain growth and molding of the head during birth. Hello, this is Ekechukudora Osioma of Anatomy Made Easy. In this video, we're talking about the fontanelles of the skull. We have 6 fontanelles: the anterior fontanelle, the posterior fontanelle. These 2 fontanelles are unpaired, so they are just 2. Then we have the anterolateral fontanelles, also called the sphenoidal fontanelles. They are paired. So we have left and right sphenoidal fontanelles. The posterolateral fontanelles are also called the mastoid fontanelles. They are also paired, left and right. So, like I said, 2 mastoid fontanelles, 2 sphenoidal fontanelles, then posterior and anterior fontanelles, making it 6 fontanelles. Let's take them one after the other. This is the anterior fontanelle. It is the largest fontanelle and it is diamond in shape. You see, it is located at the junction where the frontal bone meets with the parietal bone. The point where it lies, or the meeting point, is where the coronal suture meets with the sagittal suture. This anterior fontanelle closes at about 18 to 24 months. It is clinically important because bulging of the anterior fontanelle may indicate increased intracranial pressure, and its depression may suggest dehydration. This is the posterior fontanelle. It is small and triangular in shape. It is located where the parietal bone meets with the occipital bone. At the junction, the sagittal suture meets with the lambdoid suture. This fontanelle closes early, around 6 to 8 weeks after birth. And here is the sphenoidal or anterolateral fontanelles. It is paired, so we have one on the left and another on the right side. It is located at the junction where the frontal bone meets with the parietal bone, temporal bone, and sphenoid bone. They correspond to the region of the skull known as the terion. This anterolateral fontanelle or sphenoidal fontanelle closes at about 3 to 6 months after birth. Then we have the posterolateral fontanelle, also known as the mastoid fontanelle. It is also paired, so we have one on the left and another on the right. It is found where the parietal bone meets with the occipital bone and the temporal bones. It closes at about 6 to 12 months. Remember, this is Anatomy Made Easy with Ekechukudora Osioma. Do not just watch this video, rather like, comment, and share this video. I want to talk about some important cranial landmarks that you see on the fetal skull. Here we have the bregma. This is the point where the coronal suture meets the sagittal suture. Yes, it is the very place where the anterior fontanelle is found in infants. So now, in that place where the anterior fontanelle used to exist, on your skull, you will see bregma. Clinically, the bregma is used to assess the growth of the skull and also the fetal head position during labor. Then we have the lambda. Lambda is the junction where the sagittal suture meets with the lambdoid suture. So it is the very place where the posterior fontanelle used to be when you were an infant. It is very important in craniometry and radiological identification. And finally, we have the therion. The therion is a thin head-shaped region where the frontal bone meets with these other bones, the parietal, temporal, and sphenoid bones. It lies in the temple region. It is very clinically significant because the middle meningeal artery runs beneath the therion. If there is a fracture on the therion, it can lead to an epidural hematoma, a life-threatening condition. So what have you learned today? We have talked about the fontanelle, an essential part important for skull flexibility. It is usually present at birth, and it's also important for postnatal brain expansion. You've seen the bregma and the lambda, areas of the skull corresponding to the anterior and posterior fontanelles respectively. And you've seen the therion, the part of your skull representing a clinically fragile region that is related to the sphenoidal fontanelle. Do not forget to share this video. Bye-bye.